Sickle cell anemia is an inherited disorder in which normal glutamic acid is replaced by valine at the 6th position of beta-globin chain of the hemoglobin molecule, leading to formation of an abnormal hemoglobin S, which is less soluble under low oxygen tension. This makes it to precipitate and polymerize quickly into long fibers in red cells, which then sickle and may block the microcirculation to cause infarcts in various organs. Sickled cells are also prone to premature destruction, making their lifespan about 10 to 20 days, when compared with 120 days of normal red cells. Sickle cell anemia is most prevalent in malaria-endemic zones of the world, such as sub-Saharan Africa, the Mediterranean, Middle East, and India. The disease is inherited in an autosomal recessive pattern in which a child must inherit a copy of the mutated hemoglobin gene from each parent to develop the full disease. If a child inherits only one copy, they have sickle cell trait, making them a healthy carrier who can pass the gene on. The inheritance of hemoglobin S with another abnormal hemoglobin, such as S, C, E, and D, is called sickle cell disease. While the homozygous state of the disease, hemoglobin SS, the most common, is called sickle cell anemia. Symptoms and signs of sickle cell anemia often start around 5 to 6 months of life and can include tiredness, fatigue, pallor, jaundice, and dactylitis. Though infants may show symptoms before this age, many are protected by fetal hemoglobin, whose levels fall during this period as adult hemoglobin takes over. In the background of chronic hemolysis due to shortened red cell lifespan, patients often suffer from sudden, episodic, and sometimes life-threatening exacerbation of the illness called crisis, which may be vaso-occlusive, that is due to hypoxia causing red cells to become sticky, clump together, and block microcirculation. Hemolytic, in which deoxygenation causes red cells to sickle, become fragile and are more rapidly destroyed. Sequestration, which is mostly due to trapping of sickle red cells in the spleen and aplastic, which is due to parvovirus B19 infection causing arrest of DNA synthesis in erythroid progenitors and halting erythropoiesis. Crises are often precipitated by dehydration, infections, extremes of temperature, and stressful situations. Complications of this disease include acute chest syndrome, stroke, cardiac and renal failure, avascular necrosis, leg ulcer, and priapism. Widely used in the laboratory diagnosis of sickle cell anemia are hemoglobin electrophoresis, or high-performance liquid chromatography, which separate and identify different hemoglobin types, peripheral blood film to view sickled cells, gene analysis to look for beta-globin chain mutation, and DNA sequencing. A standard and highly accurate method, which directly identifies the specific point mutation in the beta-globin gene. Modern treatment includes disease-modifying therapy like red cell transfusion, hydroxyurea, and L-glutamine, which reduce pain crisis, and stem cell transplant offers a potential cure. Prevention of sickle cell anemia in couples who carry the gene includes pre-implantation diagnosis, in which the embryo is tested after in vitro fertilization, and the unaffected embryo is transferred for implantation or prenatal diagnosis, in which genetic testing is done using chorionic villus sampling or amniocentesis at 14 to 15 weeks of pregnancy before the child is born, so that couples can make informed decisions about continuing the pregnancy if the fetus is affected.